Okay, Denise, do you want me to go ahead and go?
Yes.
Awesome. Hi, guys. My name is Mindy Hoyer, and I am fairly new to the South Dakota Foundation for Medical Care. A little bit about me. I'm a registered nurse. Pretty much worked everywhere, ER, ICU, med-surg, OB, surgery. I'm the jack of all trades here in Mitchell. I still work PRN from time to time. Also a certified surgical technologist. I did that for 13 years prior to becoming a nurse. And then I took this position in July. And one of the reasons why I'm on this meeting today is to kind of talk to you guys about an age-friendly health system. I believe Rachel did forward some information to you guys regarding this. Basically, I'm going to just go to my document so I can kind of read off of it there. So basically what we're looking at is one of the things I'm working on is it's called the age-friendly health system, and we are partnering with Dakota Geriatrics out of North Dakota. An age-friendly health system, basically what we do is we provide like 4 evidence-based elements of high quality care known as the 4 M's. So we're going to focus on what matters, the medication, the mentation and mobility of patients that are 65 and older. So what this consists of, so like our initial steps would be creating like a work group. So within that work group, you can have a supervisor, a team leader, a provider, and so forth. Once you establish a work group, we'd come up with a project charter with some clear goals and some action items. Once you enroll with the IHI age-friendly health system, all this stuff is on the computer. You can just go to that website, enroll. You can download the guide to using the 4 M's. Once you get that filled out, you can submit the information to the Dakota Geriatrics and IHI, and you would be recognized as an age-friendly health system participant. Then you would put in a description of how the 4 M's are being put into practice. And so with that, you would, sorry, I'm going through my paper here, making sure I cover everything. With that, so basically you would identify the number of patients age 65 and older, the percentage of patients that are receiving the 4 M's. So you would want to identify a baseline, know the 4 M's in your health system, what matters, medication, mentation, and mobility. You would identify how providers are currently assessing the 4 M's and interventions and or treatments that are being done. You would teach staff about the 4 M's and identify any community resources to support patients and families with the needs and that are associated with aging. So basically what you would be doing is working with me at SDFMC and Dakota Geriatrics on the 4 M's for this. There is a little bit of data collection that we do monthly. And that is something I would be able to walk you through and help you with. Other than that, there's really not more to touch base on. Kind of a quick little overview. It's kind of fast and furious. But I just wanted to hop on this meeting just to touch base with you guys to see if this would be something you'd be interested in. I did forward, like I said, some information to Rachel. She will forward that to you, and we can go from there.
Sounds good. We can take a look at the information and we'll go from there. I appreciate the
Awesome.
information on it.
Thank you.
Yeah.
Awesome. If you guys are good, I will just hop off quick.
Thanks.
Yep.
Thanks, Mindy.
All right. I'm going to share my screen. And let's see. Before I go through what we talked about last time, I did send Isaac the tentative scope of work for next year's contract, and I've gotten that back from you saying everything looks good. So I'll go ahead and push that through our system here, and probably first week of May is when those contracts will get sent out for approval and signatures and stuff. Then I also wanted to let you guys know that the end of the quarter is March 31st. So I'll be sending out quarterly report reminders probably this week, and like to have those back by the end of April. And then I'll be sending out this week too, just a reminder to send me your participation data from this previous month. So that'll be the first time that I'll ask you guys about participation for SMBP. Otherwise, I talked with Isaac and Raymond not too long ago about cardiovascular collaborative stuff. So just thought I'd follow up and see if you've had any more discussions about that.
Yep, we have, and Lori's happy to serve on that and help out with participating in that.
Perfect. I will make sure that I get your name on the listserv and the calendar hold for our upcoming meeting. And if you want, we could set up a separate time to kind of walk through things if you'd like as well. Otherwise, just look through that website. That pretty much explains everything. And we have updated it since I talked to you guys last. So now the new strategic plan is posted online. It's easy to access now. And then the older stuff has been archived so that it's not so confusing about what's the current plan and what's the old plan. But I'll get Lori added.
Sounds good.
All right, perfect. Otherwise, why don't you guys tell me how things. Sorry, did you have something else?
I was just asking her if she wanted a quick meeting. She said she'd just review anything and then reach out with questions. So.
Okay, that sounds good.
Perfect.
All right, so I'll just pass it back over to you guys, and why don't you give me an update on where we're at with SMBP?
So, as you know, it was delayed because we have the cuffs delayed or the monitors delayed, but since then we have enrolled 3 patients on the program, all here in the last few weeks, and it has been the same provider that's enrolled the patients. We just had a meeting today, and I was able to kind of reinforce and review the program at a staff meeting today. So that was good. And the patients that we have on right now, I've been able to, 2 of them I've been able to contact and follow up. One we just recently enrolled, and I've been able to send updates to the provider on them. So
Excellent.
and we don't have any of the monitors returned yet. As I think the providers still want them to be monitoring their blood pressures right now. So.
Okay.
Mm-hmm.
And as you get more people enrolled, if you notice that you need additional educational materials, or if you'd like help looking at workflow or how it inputs into the EHR or anything like that, just let us know.
Yes, I will. And it's been the patients that we've enrolled, the clinic nurses actually have been wonderful at taking the initiative. We educated them at the very beginning on the information and where the monitors were kept over at the clinic, and they've been good about just going and accessing that themselves and giving that and educating the patients. So right now it's worked well. So
good deal.
Yeah.
All right. Well, Denise, or I don't know if Diane's still on. Do you guys have anything?
Yeah, I just wanted to touch base with you. It sounded like last time you were going to have the evidence-based programming reviewed with med staff at the April meeting. Is that still the plan?
Yes.
Okay, perfect. And just remember, Carly Swanson is kind of the guru that knows how that whole referral process works within your EMR. So she can also help a little bit with workflow and some of those things with getting those referrals to those programs. If you need any flyers or rack cards, the Department of Health has You can just order those online. They can be sent to you free of charge for all of the Better Choices, Better Health workshops. If you would like some Walk with Ease and Fit and Strong, more rack cards to share with patients or with providers as well, I would have to just order those through the Department of Health. So if you would like that, I can go ahead and do that if you don't have some of that information on those two programs.
I think not too long ago, I did receive some new cards. It's been within the last few months, I think. And I did give some of those to the clinic as well.
Okay,
So,
all right. Well, just let me know anytime that you need anything, and I can get those things ordered for you.
Thank you.
Perfect. Anybody else have anything? Otherwise, I have gotten an invoice from you guys. Sorry, did I cut you off?
Yep, no, nothing from our end. Go ahead.
I did get the invoice from you guys, and so now we're at about $9,112 left for the fiscal through this contract, so through the end of May. And I also have a conflict during our next scheduled time. We're supposed to meet Tuesday, April 26th, and I'm gonna be at our Department of Health Strategic Planning all day. So can you guys just take a peek at your calendars and see when another time would be that would work? That Monday and Tuesday, I'm gonna be out of the office. And if you want to just send me a couple times that might work, we can reschedule. And if it doesn't work very well, then we'll just figure something else out and communicate via email or something.
Okay, I'm fine with that. And Raymond, if you wanted to coordinate that, I'm fine with that as well, just a couple of times.
Sounds good. I'll look into that.
Perfect.
Perfect.
All right. Well, if nobody else has anything, then we will go ahead and talk again next time.
Sounds good. Thank you.
All right. Thanks, guys. Have a good rest of your day.
Bye.
Thank you.
Have a good day.
Two.